All right, so as we move into the pelvis, we actually have our live model here and we have the bony model over here. So when you do it, you gotta make sure you're explaining this to your patient. I'm actually going to be doing a bilateral palpation, so I'm using both my thumbs on both her landmarks. So the first one you're going to find, we always find the largest landmark point of reference, and that's going to be the anterior superior iliac spine, which Kayla is going to show over here. So we're looking for those two biggest landmarks. Let's see if I can roll up. There it is. Right there. It's usually right where the belt line is, which makes it pretty convenient. So we're going to come here, we're going to find our belt line, and for Marilee, it's right here. Now, I like to be able to hook my thumbs right underneath both the anterior superior iliac spine. Please do not say ASIS. And you can actually look and check for bilateral symmetry between them. Our next bony landmark is going to be the anterior inferior, and Kayla's going to show you them right there. Well, maybe we'll come up here a little bit. And you can see there, if she puts one finger on anterior inferior, one finger on anterior superior, you can see that they're relatively close together. But the anterior inferior is slightly medial and slightly inferior to the anterior superior. So we're going to palpate as I come back to Marilee here. I'm going to find our anterior superior right here. I'm going to drop inferior, maybe about an inch, slightly medial, and I'm going to push a little bit deep. And you're going to feel a little bony prominence. That's anterior inferior iliac spine. If she actually does a straight leg raise, you should feel the muscle tendon contract underneath there, because that is rectus femoris's origin. So you should feel rectus femoris here. Please note that I am coming nowhere near the midline, so there shouldn't really be any concern about privacy or coming anywhere near genitalia. You want to make sure you're very aware of that at all times. If for some reason a patient is concerned with it, that's absolutely fine. You can put a towel over this area as a visual reminder to you. That's fine also. So that's anterior superior coming down to anterior inferior. Our next one is going to be iliac crest. I'm going to start here back on anterior superior iliac spine, and I'm actually going to have Kayla show it. We're just going to walk our fingers around that ridge right up there. So it's actually going to palpate that ridge right there. So I'm going to start here. I'm just going to palpate, and you can see my fingers are just walking the ridge of the crest. I'm going to stop right about here and make it a little bit of a tickle zone here, but I'm actually rolling my fingers into the fossa. So I'm actually rolling my fingers on that inner part of the pelvis. Now, you have adipose tissue, you have muscle, you have other stuff there, so it's going to be a little bit difficult, but we can kind of get our fingers in that iliac fossa right here, and sort of that anterior lateral aspect. Now I'm going to ask Marilee very nicely to roll on her side so we can just keep palpating. Yep. So she's now on her side, and I can actually come this way, and I can actually cup her iliac crest just like this. I'm going to do the same thing on the model, right like that. So I'm just kind of cupping the iliac crest. Same idea here on Marilee. I can come back again, try to find that fossa by having my fingers there. But we can follow that iliac crest all the way around. We can stop and say, hello, greater trochanter, remember me? There you go. We again can do a little, bend your knee please, internal external rotation. We can feel it rotating underneath my fingers, and from here we can just continue palpating iliac crest. And now she's going to be prone, and again, as she comes prone, we don't want to lose contact with her, because again, if we disengage and we're not palpating, as a patient, she may get a little bit nervous because this is a completely blind palpation to her. So now from here, again, I'm going to look for the belt line. It's going to be the easiest thing to find. And I'm going to look for the posterior superior iliac spines, which Kayla is going to palpate for us. Two large prominences on the back. Now, one thing you can do is a lot of people have a seam here in the middle of back. That's actually where the sacrum is. So if I actually can take my hand, most sacrums are about the width of your hand. So you actually see I put my hand right there on the model. It's about the width of a hand. So if you put your hand right sort of on the seam, I should say, and you put your thumbs on either side of that, you'll feel the nice rounded prominences of the posterior superior iliac spine. Again, you can put your hand right there on the sacrum, and you'll feel the sacrum because it won't be a prominence. It'll be a sort of a flat, wider palpation, easier. And please note, my fingers are pointed caudally, cephalically. I do not have them pointed caudally out of respect for the patient. So we're going to have our fingers pointed forward or towards the head on either side. And that's posterior superior iliac spine. and her sacrum right in the middle, right on the seam. You'll be able to feel the contour of the sacrum. It is sort of contoured like this. You'll be able to feel that contour. And as it starts to dive back anteriorly, we're going to stop our palpation because there's no reason to go looking for the coccyx bone at this point. The last one we're going to do is the ischial tuberosity. It is a pelvic palpation, so we're looking for that landmark down here. We're going to say hello to the hamstrings. We're basically will be looking for the vertical fold of the gluteal cheek. Make sure you're explaining to your patient what you're about to do. So merely, I'm going to palpate your ischial tuberosity. I'm actually going to come up and underneath your gluteal cheek. Don't start down here and kind of slide. Don't do anything creepy or drop down or anything like that. Again, you can put a towel here. You should be staying away from the midline, staying away from genitalia. There's no reason to go there. And you just basically kind of start here, come right underneath the gluteal fold, and you will feel the bony prominence of the ischial tuberosity. If she does a straight leg raise, so she's going into hip extension, you will feel the hamstring muscles contract underneath your palpation because you're going to be activating all three hamstrings, so they have that common origin right there on the ischial tuberosity. So major landmarks, please make sure you're communicating with your patient, talking to them, and letting them know. Oh, I did forget one. Oh, yeah, so we're going to go back to supine, probably the most awkward palpation, and I have never really palpated this one. This is what we like to do with a patient palpation. So we'll have the patient do it. So I'm going to ask the Marilee to put her hands just like she is, one on top of the other. And we usually have them start up by the umbilicus, by the belt line. And we just say, again, over the clothes. Never do anything under clothes. We're just going to have her slide her hands down the front until she feels the bony prominence of the pubic symphysis, which on the model is right there. A cartilaginous joint. Remember, there's your cartilage disc right there. And she can push down and put some pressure, and she can actually give me feedback. Does that pain? Is that painful to touch, etc.? So I can actually use her as an extension of my own palpation skills. If you want, and if you feel comfortable and the patient feels comfortable, you can actually palpate on top of that. So if I wanted to, and I need to, I can actually put my hands on top of hers and I could push down. So again, I am not coming in anywhere contact with her directly. I'm using her hands as a barrier, again, for modesty, for respect out of the patient, etc. But unless you have a very good reason for palpating pubic symphysis, there's no way to do it. And I did forget to mention, for all these palpations, we are over the skin. So if they have spandex, that'd be ideal, baggy shorts, etc. But if they are wearing baggy shorts, we don't go under the baggy shorts. We're always above clothing at this point. There's really no reason for you to have to go under. So those are our major bony landmarks.